We need more men to really be vocal on spreading the awareness.
There is the feel that the public education in respect of HIV/AIDS has waned over time. What's the plan?
Public education requires funding, and we have been doing public education. I think there was a shift in public education when we had Treat All being implemented to persons living with HIV, and there may have been a small fall off in our prevention voice. But our prevention voice has always been there. I think there has to be a wider conversation in prevention, and not just about condom use, but we have to look at wider sexual practices. We have to enable our youth and empower our youth to be able to make informed decisions. And through the Ministry of Education and Youth, they do have the health and family life education that has started within our schools, but that has to be done on a more tangible and wide-based setting in terms of going to the community. So yes, you're hearing it at schools. Yes, you're hearing it on the media. Yes, you're seeing billboards and you're seeing the buses, but the discussion at the community level needs to be pushed, because we're not just speaking about prevention. We're speaking about stigma and discrimination. We're speaking about disclosure. We're speaking about treatment. There are several arms and issues within the HIV response that need to be passed on to our community, not just our children, not just the persons who can read and write, but everybody along the spectrum.
I don't see that level of emphasis again on the matter of HIV/AIDS prevention and condom use, for example. Am I wrong, Candace?
The truth is, in years gone by, we had a lot of resources, way more resources available for us to be, for example, every prime time you would be hearing ads around condom use and, HIV awareness. We don't have that level of resources anymore. There used to be way more players in the HIV response before, way more organizations at the community level, other NGOs were active. And with the drying up of the donor funding, or, with the streamlining of the funding, a lot of persons have really closed their whole voice to it. And so we keep saying, we need other partners. HIV has not gone anywhere. We need to still be having the conversations as if we were in the early 2000s. So I would agree that there is a fall off, but the ministry can do what the ministry can do. But I think we need way more persons to get involved. We have to engage more players to be there with us. And we have to use up the social media.
We have always heard about the myths surrounding HIV and AIDS, and one of the most prevalent ones is among men, especially, that if you have sex with a virgin, you can cure yourself. Is that still prominent and prevalent right now, and how much worrisome is it?
The myths are always worrisome. It's like every time, we have to keep reminding ourselves, especially those of us who work in this sector, not to get annoyed when people repeat these myths to us, because we are worried that at this stage of the epidemic, we are still talking about, having sex with a virgin. There is no truth to that. Absolutely no truth to that. In fact, all you're doing when you have sex with someone, unprotected sex with someone, knowingly that you're HIV positive, is increasing the opportunity of transmitting the virus to someone. And so we want to dispel that myth and to say it doesn't work, but yes, we still do get it. And this goes to the lack of awareness. And I don't even think sometimes it's the lack of awareness. It's really believing the facts. People really need to believe what we're saying, the fact that it doesn't exist. I want to use that to point to just the risk of being a young person navigating sex and sexual relations in this situation, because we're seeing where if we continue to propel these myths, then that continues to put especially the young person who needs to navigate these experiences at risk of contracting HIV. So it has to come from multiple spaces. It has to come from that community of men who men who believe that, but other men who know and can actually say to men that, listen, that's foolishness. That's in the HIV sector, we always say, where are the men in the response? We need more men to really be vocal on spreading the awareness. you know, to say these things are not true, and to show that real manliness is a man taking responsibility and really doing the right thing.